Welcome, everyone, to the Legal Levers for Health Equity and Housing webinar series. Today's webinar, Building and Maintaining Safe and Affordable Homes, is the second in a three-part series co-hosted by the National Center for Healthy Housing, the National Low-Income Housing Coalition, and our colleagues at the Center for Public Health Law Research at Temple University, whose recent work inspired this webinar series focused on exploring the goal of health equity in housing through the lens of laws, policies, and other legal mechanisms, to help us really better understand how those levers may support broad-reaching systems change to establish access to safe, affordable housing. If you missed the first webinar in our series, Creating Diverse Neighborhoods and Communities, don't worry, you don't have to miss out. The webinar was recorded, as all of the webinars in this series will be, and you can access a recording of that webinar as well as the slides at the link shown at the bottom of your screen. Before we dive in, let me remind everyone that all participants are in listen-only mode, but that doesn't mean that we don't want to hear from you. We absolutely do want to hear from you. So we ask that you please enter any comments or questions that you have in the chat or Q&A boxes that are likely on the right-hand side of your screen. And we'll get to as many of them as we can during the discussion time at the end of the webinar. You can enter questions at any time, so you don't have to wait until the end, but we'll make sure to answer as many of them as we can as we close out today's session. As I mentioned before, we'll also be recording today's webinar, and we'll share the link with everyone who has registered, along with a copy of the slides from today's presenters. So why housing? Housing is one of the most well-documented social determinants of health, affecting residents through multiple pathways, as you see outlined here on your screen. And as such, is also a powerful platform for transforming and supporting resident health and well-being. For most Americans, home provides security and shelter, but homes that are unaffordable, that are located in areas that have environmental hazards or lack basic services, or that are poorly constructed or maintained can significantly impact the health and safety of residents. Many of us on the line today have understood these connections for a long time, but the importance of housing has become even more apparent over the last several months as we've been asking people to spend more time at home and telling them that they're safer there. And while we all agree that social distancing and sheltering in place are critical public health measures to combat the ongoing global pandemic, the reality is that being at home might make you safer from COVID-19, but not all families are able to be safe at home right now. Some families are facing eviction or housing instability. Others are sheltering in place and spending close to 100% of their time in unsafe environments that may contain lead or asthma triggers or other hazards. I know that here at NCHH, we've been reflecting a lot in recent months about how much of the work that we do is necessary because of a long history of racist housing policy. And that's why the type of approach that we'll be highlighting today that really centers equity and racial justice is so essential. If you're tuning in today, we probably don't need to convince you that we have a housing crisis in this country and that much, much more needs to be done to make homes safe, healthy, and affordable, especially among low-income families. But I hope that you're also going to leave today feeling inspired that housing doesn't just have to be this big, overwhelming problem. It's also one of the most powerful solutions available to help us solve some of our most pressing societal problems, and how that equity lens that we're going to be using today and throughout this webinar series can really be the key to helping us work with communities to solve multiple problems. During today's webinar, Building and Maintaining Safe and Affordable Homes, which again is the second webinar in a three-part series, presenters from Temple University's Center for Public Health Law Research, the National Low-Income Housing Coalition, and ChangeLab Solutions will explore research and best practices for how we can build health equity in housing by improving and maintaining housing quality and by increasing and maintaining housing affordability. The panelists will revisit the goal of health equity in housing and the importance of holistic systems approach before exploring research and existing efforts to increase access to safe and affordable housing, support housing code enforcement, and ensure healthy housing for all. I'll briefly introduce each of the presenters as we go, but you should know that all of our presenters are incredibly accomplished, and I'd take up our whole time together if I tried to list all of their accomplishments. So I encourage you to read more about them online. To get us started today, I am pleased to introduce Katie Moran McCabe, who is a Special Projects Manager with the Center for Public Health Law Research at Temple University's Beasley School of Law. Katie has managed several housing projects for the center, including the development of the housing report series that is the focus of this webinar series, the creation of the City Nuisance Property Ordinances dataset, and has recently been involved in the state COVID-19 Emergency Declarations and Mitigation Policies dataset. Katie?
Thanks, Amanda. And I want to thank the National Center for Healthy Housing and the National Low-Income Housing Coalition for co-hosting this webinar series. We're really excited to have this opportunity to have this important discussion today. So I'm going to talk a bit about some of the housing research that we've done at the center as it relates to legal levers for health equity in housing. The research for this work was funded by the Robert Wood Johnson Foundation's Policies for Action program, and we thank them for their generous support. So the focus of this webinar is housing affordability and housing quality, which are both critical for a healthy society. And I want to start by recognizing that these two issues are pieces of the larger system that is complex and made up of many people, organizations, laws that all interact to produce the current state of housing that we have today. And if we look at what that housing system has produced, you can see, from the statistics here, that the results have not been great. Research from the National Low-Income Housing Coalition shows that millions of renters spend more than half of their income on housing costs. And this disproportionately affects Black households who are more likely than white renters to have extremely low incomes. There are also too many people in the United States living in poor housing conditions, dealing with lead-based paint, mold, and other hazards. And now COVID-19 has really highlighted and exacerbated these issues due to unemployment, loss of income resulting from the pandemic, and with that, the inability to keep up housing costs. In addition, as Amanda highlighted, to the increased time spent in homes, many of which are unsafe. So it's clear now more than ever that the housing system that we have is not working as is and not producing the kinds of living conditions that we need. So what should the system be producing? And what we need, in our view, is health equity in housing, meaning that everyone living in the United States has the option to live in safe, affordable housing in racially and socioeconomically integrated communities where all residents have access to good schools, transportation, parks, recreational facilities, economic opportunities. This is what's essential. This is what we need to be healthy and thriving as individuals, as communities, as a country. So in our Legal Levers housing project at the center, we aimed to identify laws and policies that could be used to promote health equity in housing. And we know that law has played a large role in creating many of the housing problems that we have today. And so we recognize that law must play a role in alleviating a lot of these issues. And because housing is such a complex system, we developed a systems model to organize these levers. The model is made up of 5 domains, which you can see on the slide here. And for each of the levers that we identified, we wanted to find out, are these levers actually doing what they're intended to? Are they achieving their goals? And if so, are they also achieving this broader goal of producing health equity in housing? And then finally, how can these levers be better designed and used for health equity in housing? And for most of the levers, we found that either they really have not been very effective in producing health equity in housing, or in many cases, there just isn't enough evidence to really know what their full impacts are. So I'm going to touch on just a couple of the legal levers related to housing affordability and housing quality. We don't have time today to talk about all of the levers, but at the end of the presentation, I've included a link to our report series. So if you're interested in reading about them, you can do so. So when we think about housing affordability, it seems that there are really 2 prongs to that. One of those is having a sufficient supply of housing that's affordable to those with low incomes. And one of the biggest levers for increasing the supply of new affordable housing is the low-income housing tax credit program. This makes housing affordable for many people, but often these subsidized homes are still not affordable to those with extremely low incomes. Another issue with this program is that developments are often located in higher poverty areas, so it hasn't really been effective in substantially reducing the concentration of poverty or reducing racial segregation. Land use regulation or zoning is another lever that can have a really big influence on the development of new affordable housing. It really has a powerful effect on what gets built where. For example, zoning laws that prohibit multifamily developments or have other restrictions that limit multifamily development may essentially exclude affordable housing from those communities, since multifamily housing is more likely to be affordable than single-family homes. And as we were doing our research, one major theme that came up was the barrier to health equity in housing that exclusionary zoning presents, and the need to really address zoning issues in order to achieve health equity in housing. But this is a challenge. Substantial changes to zoning laws will likely not be easy. There are a lot of NIMBY attitudes, so not in my backyard attitudes, some of which are based in racism, may also be based in concerns about housing values and personal wealth. And these present significant obstacles to affordable housing development. Some of the experts that we talked to in conducting our research pointed to ties between exclusionary zoning and racial segregation, which also was highlighted as a fundamental barrier to achieving health equity in housing. There are real and ongoing effects of segregationist policies. People of color having less wealth because their grandparents were denied the opportunity to purchase a home in a decent neighborhood. So there's a lot of work that has to be done as far as zoning reforms to ensure that affordable housing can be built and can be built in areas where it promotes integration. Okay, so we just talked about increasing the supply of new affordable housing as one prong of housing affordability. The other issue is increasing income for households so they can afford housing. Housing costs are too high in many places, but low incomes are also a big barrier to securing decent and safe housing. Rental housing programs are levers that could be used to increase the amount that someone is able to pay for housing. The Housing Choice Voucher Program is one of the biggest federal rental assistance programs, and has made housing affordable for many people, but there's some areas for potential reform there as well. It hasn't been sufficiently funded. Only somewhere around 1 in 4 people who are eligible for a voucher actually get one. And there are some other issues with the program that could be addressed also, and you'll hear some more about that later in the webinar. Minimum wage is another lever that could be combined with rental assistance to make housing more affordable. But currently there's a big difference between federal minimum wage and housing costs. There are many states that have minimum wages that are higher than the federal minimum wage, but that's by no means the rule in every state. So to achieve health equity in housing, homes must not only be affordable, but also safe and free of hazards. One big problem that needs to be addressed as far as housing quality is lead-based paint poisoning. There are many laws aimed at addressing this issue, yet there are still millions of homes in the United States that have deteriorated lead-based paint and elevated levels of lead in the home. And these can cause health problems for people living in those homes. Most state laws addressing lead-based paint in homes are based on secondary prevention, where high blood lead levels are identified through screening programs. And once that they're identified, it's then that action is taken and interventions are taken in homes where children have been found to have high blood lead levels. So this can be problematic because at that point, children have already been exposed and may already be sick before action is taken. Some states and cities require lead inspections before a home can be rented, and this seems to definitely be a promising approach, but the majority of jurisdictions have not adopted similar policies, leaving many children to continue getting sick from lead-based paint in their homes. More broadly, housing code enforcement is another lever that could be used to really improve housing quality. Most municipalities in the United States have local housing codes, yet there are still many places where renters are exposed to housing hazards. There are definitely some potentially promising models of code enforcement, such as proactive code enforcement, and you'll hear a bit about that later in the webinar. So none of these levers, either alone or in combination, have yet been truly successful in achieving health equity in housing. And for that, we need change, big, innovative change. It seems, at times that laws are passed to address a problem, and it might be assumed that the law would have the desired effect and solve the problem it was meant to fix. But we found that largely that has not been the case with health equity in housing. There are certainly, levers that work in some places and on a smaller scale, but we need to think about how to scale up those levers that are promising. As well as changing laws and policies that really are not working. And all of that involves, stepping back, thinking about the big picture, thinking about the history of our housing problems in the United States and what is needed to achieve real change. I talked briefly when we were talking about zoning, talked briefly about segregation. That's something that's endured in this country for a long time. And overall, law really has failed to eliminate or even substantially reduce it. And in order to do that, to really address segregation and opposition to zoning that allows for affordable housing, we need a substantial change in social attitudes, dealing with issues of racism, NIMBYism that communities are dealing with. Also, there needs to be some serious thought given to what substantial changes need to be made to budgets, so that we have enough resources for code enforcement, for enough affordable housing, for rental assistance programs. The problem in the United States is not necessarily the lack of money, but how money is spent. And making big changes to budgets that will, that going to require a shift toward, making housing a higher national priority. A shift from thinking about housing as a commodity to viewing it, as many folks on this webinar likely do, as a basic need that we are all entitled to. So, all of these types of changes are necessary to achieve health equity in housing, which itself is necessary for a healthy society. And the change that's required must be systemic. So small incremental change won't be enough to truly achieve health equity in housing. It's really important to remember that housing is a system. These levers are interconnected. Adjusting one can affect another. So we really have to keep in mind that no one lever will be the answer. So for example, there has to be enough low-income housing tax credit housing, but it's got to be affordable to those even with the lowest incomes and located in high opportunity areas where there's effective code enforcement policies to ensure that the housing is safe and hazard-free. We like to think about these levers as dials on a soundboard, and the goal is to use them together to create the perfect sound, in this case, equity. And I think everyone watching this webinar knows why fixing our housing system is so important, and that housing is a fundamental need. As Matthew Desmond said in Eviction, decent, affordable housing should be a basic right for everybody in this country. The reason is simple: without stable shelter, everything else falls apart. So this is where you can find our 6-part report series. Please check it out if you're interested, and don't hesitate to contact us with any questions. So here's my contact information, and I'm happy to answer any questions at the end of the webinar. Thank you all so much.
Great, thank you, Katie. And thank you to those of you who are submitting your questions and comments. We hope to have some time at the end to get to all of those. Next, it is my pleasure to introduce Andrew Arend, who is Vice President for Research at the National Low-Income Housing Coalition, a national research, policy, and advocacy organization whose mission is dedicated to achieving socially just public policy that ensures people with the lowest incomes have affordable and decent homes. At the National Low-Income Housing Coalition, he leads the research team that annually documents the housing needs of low-income renters and conducts research to improve policy. Andrew?
Thanks, Amanda, and thank you to everyone for listening today. Like Amanda mentioned, we're a national policy, research, and advocacy organization, and we're a membership organization, and we have nearly 1,000 members. Many of our members are other organizations, including state housing coalitions, and so our overall subscriber list that receives our publications and our policy alerts and our calls to action is about 180,000 people. I should also mention the coalition focuses on federal policy, and we focus on rental housing because households with the lowest incomes rely more heavily on the rental market than on home ownership for their housing. And in her opening presentation, Katie mentioned two of our annual reports on housing affordability. One of our annual reports is called Out of Reach, where we provide what we call the housing wage, which is the hourly wage that a full-time worker would need to earn to afford just a modest 1-bedroom or 2-bedroom apartment. And we find that on average, a full-time worker would need to earn a little under $20 an hour, $19.56 an hour, just to afford a modest 1-bedroom apartment. And of course, that's far higher than the minimum wage, and it's even higher than the median wage of some of our low-wage occupations, like people working in retail, food service, home health care, personal care, janitorial services. In fact, 12 of the country's 20 largest occupations actually pay a median wage that is less than what someone needs to earn working full-time to afford a 1-bedroom or 2-bedroom apartment. But I'm going to focus a little bit more on our other report that we publish every year called The Gap, which there's some statistics on the next slide from The Gap. And in that report, we estimate the shortage of housing for extremely low-income renters. And these are renters whose incomes are below the poverty level or below 30% of their area median income. Just to put that into some context, the poverty level income for a family of 4 is about $27,000. What they could afford to pay in rent is no more than $650 or $675 a month, and many of them cannot even afford that. And we often hear about the nearly 11 million renters that are severely housing cost burdened in the US. And I think it's important to point out that 72% of those 11 million renters are extremely low incomes, or they have extremely low incomes. And that's predominantly because we have a national shortage of 7 million affordable and available rental homes for that income group. And this group by far faces the gravest affordability crisis, and it has for a very long time. And we also need to recognize that the market, it doesn't serve these households well. Actually, it cannot adequately serve these households simply because of how little many of these households can afford to pay in rent. And on the next map, you'll see a state map that shows the number of affordable and available rental homes for every 100 extremely low-income renter households. And every state, and for that matter, every metropolitan region and just about every county has a shortage. The state with the smallest relative shortage, West Virginia, still has a shortage, and it only has about 62 affordable and available rental homes for every 100 extremely low-income renters. And many states, it's far worse. So for example, in California, there's only 23 affordable and available rental homes for every 100 extremely low-income renters. And I just want to mention on the next slide that in addition to this significant shortage of 7 million homes, we also have to recognize that housing that is affordable to extremely low-income renters, or even low-income renters in general, is often at risk of being lost from the affordable housing stock. Among the subsidized stock, rental contracts associated with project-based rental assistance expire, affordability periods associated with the low-income housing tax credit expire, mortgages associated with USDA programs mature. And so, we constantly have a need to work for preservation of existing affordable housing that we do have. We just recently released a report, that we estimated that current rent restrictions expire on about 300,000 federally supported rental homes within the next 5 years. Now, we do have to acknowledge the affordability will be preserved for most of those units, but even if we lost 5% or 8% of those 300,000 units, we're talking about 15,000 to 18,000 units lost. And we also have to recognize that many of these units that are losing their rent restrictions are older properties. If you look at the graph on the right, the first orange bar, 79% of these properties have not received a capital subsidy for physical improvements in the last 20 years. And so we have a significant need for capital investment in these existing affordable housing properties. And so that, brings me to today's topic of building and maintaining affordable homes to address affordability for health equity. And I just want to mention that the domains emphasize the domains of legal levers that are presented by the Center for Public Health Law Research. They are a great way to look at how to achieve health equity in housing. We need to increase the supply of affordable housing. We need to preserve or maintain the current supply. We need to provide choices for poor families. We need to be concerned with fair housing. And of course, we also have governance concerns. And with that in mind, I'm going to spend my next couple of minutes talking about the policies that the coalition sees as being very important to achieve both better affordability and health equity in housing. And the first thing I'm going to start with is capital investments to both create and preserve our affordable rental housing supply. First off, we really need to acknowledge that we need significant investment in public housing because it remains an extremely important component of our affordable housing infrastructure. It currently provides stable housing to about 1 million households whose average income is less than $16,000 a year. And so it's very important that we protect this stock. Unfortunately, as most of you probably know, public housing has a significant backlog of capital improvements due to insufficient appropriations from Congress that has been a continual problem. And some estimates of the cost of this backlog are as high as about $70 billion. And there has been legislation introduced in Congress for this money. So for example, the Housing Infrastructure Act of 2019 that was introduced by Maxine Waters includes money to deal with that backlog. We also need greater investment in the National Housing Trust Fund, which is a relatively new program that is basically a block grant to each state, which then allocates the funds to developments across the state, as long as those developments serve renters with extremely low income. Last year, 2019, the National Housing Trust Fund received about $248 million in mandatory contributions from Fannie Mae and Freddie Mac, which is a good start. That's the way the fund is currently funded, with the contributions from Fannie and Freddie. But it's significantly below what we need in order to close that gap of 7 million affordable and available homes. And there have been multiple bills introduced in Congress just in the last year that include significant funding for the National Housing Trust Fund, because a lot of people recognize how important it is, that we provide housing for the lowest income renters. And then the other program that Katie mentioned is the low income housing tax credit. And as Katie mentioned, this is by far the largest subsidized production program in terms of rental housing in the country. It's been responsible for about 3 million rental units since its inception in the late 1980s. Those older properties, we need to work on preserving them as they approach 30 years, which in many states is the end of their affordability period. So because of the growing need to preserve existing affordable housing and the significant shortage of affordable homes that we have, we really need to increase funding for this program as well. There's currently a proposal in Congress to increase the available tax credits by 50%. But we also think that reform can be made to ensure that the program better serves renters with extremely low income. So unlike public housing, which ties rents to a tenant's income, or unlike the National Housing Trust Fund, where most rents need to be affordable to renters at 30% of area median income, most LIHTC developments can set rents to be affordable to renters at 50 to 60% of area median income. That's not affordable to extremely low income renters who don't have other forms of housing assistance. And so extremely low income renters often need rental assistance in order to afford LIHTC units. And so we have also proposed a boost in tax credits for developments that set aside at least 20% of units for households with extremely low incomes. That reform, and plus the additional 50% increase in tax credits, is in the Affordable Housing Credit Improvement Act, which has been introduced a number of times. Bipartisan support for that act, by the way, and it's been introduced a couple of times now. I also want to talk briefly about rental assistance and mobility programs. In addition to capital investments in the actual affordable housing stock, we also need to increase our funding to rental assistance programs like the Housing Choice Voucher, where low-income tenants receive a voucher, which then helps them afford rental housing in the private market. I should just mention, in many markets, the housing exists. The problem is renters can't afford the housing that is available in the market. And so vouchers allow renters to find modest housing and afford modest housing in their housing market. A fully funded voucher program, we estimated would cost, roughly $76 billion. a year. And prior to tax reform, that's just a little bit more than what we used to spend on the mortgage interest deduction that mostly went to affluent homeowners. And I say that just to point out that we have the resources. Like as a country, we have the resources to fully fund these programs, to stably house everyone who needs stable housing. But we just have not had the political will to do it. In addition to more funding for rental assistance for the Housing Choice Voucher program, there are a couple of improvements that could be made. One is, we feel that more public housing authorities should set their payment standards for the voucher based on small area fair market rents. And I just want to take a minute to explain. Typically, voucher recipients contribute 30% of their income towards rent, and then the remainder of the rent is paid for by the voucher up to a particular payment standard, which is usually, for a modest apartment. Traditionally, that payment standard has been set region-wide or county-wide. And so what that means is the same payment standard is used in, whether it's a low-cost neighborhood or a high-cost neighborhood. And so it really makes it hard for voucher recipients then to use their voucher in higher opportunity neighborhoods that may have higher cost rents because their voucher doesn't support rents that high. The fix to that is small area fair market rents, which are set at the zip code level. And so what that means is the voucher payment standard is higher in high cost zip codes and lower in low cost zip codes. And research has shown that that provides that more housing that's available to voucher holders in higher cost, higher opportunity neighborhoods. The other thing we know from research is that if public housing authorities had the resources to provide help through mobility programs, then voucher holders would have a wider range of options and be more likely to move to higher opportunity neighborhoods. And so what I mean by that is, we've seen from research that time spent on landlord engagement, recruiting landlords by, explaining to them how the program works, providing housing search assistance and housing counseling to voucher recipients, and providing some financial assistance to help voucher recipients move or help with their security deposit. One disadvantage or one thing that's lacking in the voucher program is vouchers do not pay for moving costs or for security deposit. And so if you're an extremely low income renter and you've now been given a voucher, you still need to find the resources to pay the security deposit. And so there are some programs that do that, and that opens up more opportunities then to the renters. So I threw this in here at the last minute because in our last gap report, we showed that there's a clear relationship between these affordable housing programs that I had just been talking about and affordability for extremely low income renters. And so if you look at the upper left, this scatter plot, you'll see Boston and Providence that are typically considered high cost housing markets. And yet a smaller percentage of extremely low income renters are severely cost burdened in those markets. And we're often asked why. And the reason why is because Boston and Providence are two examples that they are older cities. They have a significant supply of subsidized housing through both public housing and project-based rental assistance. Far more of the share of their rental stock is HUD assisted than say in places like Houston or Las Vegas. And so you'll see that if you look at the x-axis there, that the share of ELI, extremely low-income renter households that are severely cost-burdened in places like Boston and Providence, although it is high, is lower than in places like Las Vegas or Houston or other newer cities in states that have not invested substantially in affordable housing. And one other thing we need to talk about is emergency rental assistance. In terms of protecting the housing stability of renters, and we see this so significantly now during the COVID pandemic, is we need emergency rental assistance to help keep families stably housed when they're experiencing a short-term financial crisis. We know that a lot of renters, they're paying their rent now, but they really are just one crisis away from not being able to pay their rent. And if it is a short-term disruption, the crisis is a short-term disruption to their ability to pay, then it's far better to keep them stably housed where they are than to see them lose their housing. Two other things I want to also quickly mention is state qualified allocation plan. And, as I mentioned, the low-income housing tax credit is the largest rental housing production program in the US. Credits are allocated to states. States then award developments with those credits using some form of criteria. So it's oftentimes for the 9% tax credit, it's a competitive process. So developers need to apply for those credits. to the state finance agency. The state finance agency scores those applications. It scores those applications on a set of criteria that are laid out in what is called a qualified allocation plan. These plans can be changed and are open for public comment on an annual basis. And I will just say that I strongly encourage people to become familiar with what is in those state QAPs. States can provide additional points for developments that are located in neighborhoods with certain amenities, like say close to public transit, close to other amenities like grocery stores, other necessary facilities. They can reward or require longer affordability periods that extend beyond 30 years. They can award points if developers agree to sell to a nonprofit after a certain amount of time. Those are set at the state level. And so if you're concerned about patterns of development within the LIHTC program, or you want to ensure that the program serves those with the greatest need, one of the ways to do that is to look and see what is in the state qualified allocation plan, because that's where the state lays out its criteria. Just one small caveat to that, though, is that we should really be cautious of how those criteria are implemented, because sometimes there are some unintended consequences. So for example, if you strongly incentivize development near public transit, if it's not done correctly within the allocation plan, you could, without adequate precautions, sort of create a disincentive to produce more affordable housing in rural areas, even though rural areas also have a significant need for more affordable housing. And then finally, I just want to talk a little bit about fair housing. It's a significant concern, of course, in many ways. I mean, I don't really have to say that. Currently, in many areas of the country, landlords can refuse to accept vouchers, housing choice vouchers, for no reason other than they don't want to accept a voucher. So some states and jurisdictions have put protections in place to protect voucher holders from discrimination. These are known as source of income protections, or a ban on source of income discrimination. And we know that voucher holders receive fewer rejections from landlords in places where there is currently a ban on source of income discrimination. And so we strongly encourage that at the local, state, and even federal level. We also need to affirmatively further fair housing. The Obama administration, after years of work, implemented the final AFFH rule, which had required jurisdictions to actively study and work to address the segregated patterns of housing within their jurisdiction. They were required, for example, to examine the location and distribution of subsidized housing, and also racial and economic concentrations relative to schools and other forms of opportunity. That rule has been abolished by the Trump administration, also over the strong objections of many in the affordable housing community. And then the other issue I don't have on the slide, but I want to mention is the administration's currently they has just recently proposed changes to the equal access rule for homeless shelters. Currently, shelters funded through HUD need to provide equal access to shelter based on a person's self-identification of gender. So if a person identifies as male, they are considered male, or female, they are considered female. The administration has proposed ruling that level of equal access back, and instead allows shelters to determine gender based on visible characteristics, their own perception of the person's gender, rather than the person's self-identification of gender, which can do significant harm to gendered individuals. That is a proposed rule, and it's currently open for comment. So we really encourage people to comment. So thanks a lot. Bye.
Thank you so much, Andrew. And finally, it is my privilege to welcome Greg Meow, who is a senior attorney with ChangeLab Solutions, where he leads the organization's work to make safe, stable, and affordable housing a reality for everyone. In addition to housing, he also works on other manners by which land use laws can be used to promote health equity. And in a previous life, he also represented several communities as a municipal attorney. Greg?
Thanks, Amanda. So I just wanted to begin by revisiting why we're all here just a bit. And it's because housing is a basic need, as we've talked about. Decades of research have shown that safe, stable, affordable housing sets the foundation for health. Housing located near good schools, high-quality jobs, healthy food, safe parks, and dependable transportation is essential for communities to prosper and thrive. However, our housing policies historically have not been guided by a vision of healthy and equitable communities. Indeed, many existing housing policies reinforce discrimination and economic exclusion, leading to disinvestment and inequitable health outcomes. These forces have compounded health disparities and made it difficult for residents and government to ensure the health and well-being of all residents. And there's an adage in public health that your zip code is a better predictor of health than your genetic code. And it holds true largely because of the policies that perpetuated neighborhood segregation, and created concentrated pockets of disinvestment and wealth. Just for example, a study by the Kirwan Institute found that people who lived in formerly redlined areas of Cleveland had higher rates of exposure to lead and toxic waste, infant mortality rates 5 to 6 times higher than those in non-redlined areas, and a 15-year reduction in life expectancy. So, as the other speakers have identified, we have a lot of housing challenges. And while I don't want to dig too deep into all of them, I think it's worth reviewing them quickly because it's important to understand where the challenges come from and how they relate to each other so that the models we utilize and the laws that and policies we implement to support remedying the challenges, remedy all of the challenges, or at least don't exacerbate them. And so the first challenge that I think we need to acknowledge is the role of systemic racism. We are living in a world today that has persistent place-based and race-based health disparities that are the direct result of our past racist housing policies. And just quickly, for example, this is a 1930s redlining map from Oakland. For those who are unfamiliar with redlining, in the 30s, the Homeowners Loan Corporation, that's a precursor to HUD, created residential safety maps depicting areas deemed safe to issue low-interest long-term loans for new homeowners. Neighborhoods were classified into one of 4 categories based on favorable and detrimental influences. Factors included terrain, type and age of buildings, as well as the threat of infiltration from foreign-born, Negro, or low-grade population. And so A areas were depicted in green, and they were the hotspots. B areas in blue were deemed not as desirable, but still good. C areas in yellow were considered in decline, and then D areas in red were considered to be in full decline that lenders should steer clear of. And so not surprisingly, this classification method was heavily influenced by racial and economic demographics. And banks quickly adopted the identification system, commonly denying home loans to residents in neighborhoods considered risky. And so the color coding of maps became a verb. To redline a community was to mark it as undesirable and not worthy of investment. And although this was officially prohibited by the Fair Housing Act in 1968, the practice of neighborhood delineation based on race and class, along with other racist housing policies, such as restrictive covenants, blight and appraisal guidelines, and exclusionary zoning, have systemically excluded whole swaths of our population from accumulating wealth through property ownership. And the consequences of these historically racist housing policies include then the increasing wealth gap between homeowners and non-homeowners, as well as between Black and white households. Additionally, by creating the concentrated pockets of poverty we see, these policies have led to inequitable distribution of social determinants of health, such as access to healthy food, safe neighborhoods, quality healthcare, and affordable housing. And as Andrew talked about, there's a significant affordable housing problem right now, at least partly due to the ongoing racist housing policies that I just discussed, which keeps affordable housing and lower-income people out of wealthy and middle-class neighborhoods across the country. And while Andrew talked a little bit about the affordable housing gap, I wanted to emphasize that the gap exists not only because we aren't building enough new affordable housing, but also because we're continuing to lose significant chunks of our existing affordable housing stock, as you can see from this report by the Joint Center for Housing Studies at Harvard. Another major housing issue our country is facing is housing quality. Poorly designed homes or unsafe structures compromise the health and safety of all people, but they're particularly risky for older adults whose falls may have debilitating consequences such as broken bones, as well as head injuries. And as of 2017, more than 5.9 million housing units, or about 5.2% of all US households, were considered substandard with multiple or severe health hazards. And 39 million housing units nationwide contained at least one health hazard. These health hazards include things such as structural defects, lack of safety measures, poor indoor air quality, poor water quality, unsafe resident behavior, the presence of pests and refuse, dampness and mold growth, exposure to toxins and lead and asbestos, carbon monoxide, and extreme temperature. And the cost of these hazards is significant. Poor housing conditions are associated with chronic and infectious illness, injury, poor nutrition, poor mental health, and brain development, and can contribute to household income insecurity. And so these two issues, housing affordability, including access to affordable housing, and housing quality, are inextricably intertwined. The lack of affordable housing available helps enable the existence of housing quality issues. As housing quality pressures mount, tenants are left with little recourse to deal with predatory landlords that are able to take advantage of their need for shelter, even if it means living in housing that is hazardous to their health. And housing quality issues can lead to direct health consequences, increasing household expenditures, reducing households' ability to afford housing. And both housing problems then can directly lead to the negative health outcomes and contribute to increasing housing instability. So these challenges of structural racism, housing affordability, and housing quality do combine to create the housing instability we see now, where people are living and moving between housing that is unaffordable, low quality, and overcrowded, and located in neighborhoods lacking opportunities. And this too has negative impacts. Research shows that housing instability in forms of frequent moves, homelessness, and being behind on rent can negatively impact caregiver and child physical and mental health, and reduce household access to key health promoting opportunities. And I would just be remiss if I didn't mention quickly how COVID-19 has exacerbated all of these existing housing challenges. As more people are laid off or see reduced hours, they're more likely to face difficult decisions about making their monthly rent or mortgage payments or putting food on the table, and it's increasing fear of ability to stay in people's homes. And just to put that in context, 16.5 million American renter households have at least one worker in an industry that is immediately affected by the economic fallout of COVID-19. And roughly 43%, or 7.1 million people of potentially impacted renter households were already struggling with rental cost burdens before the crisis took hold. And with regards to housing quality, our homes are not designed really for us to inhabit 24 hours a day. Increased stay at home is putting stress on our ventilation, plumbing, and other household systems. And we're causing more and more wear and tear on them as well, which can lead to increased utility bills and need to repair. Additionally, as more people are struggling to make rent payments as a result of the economic impact of the pandemic, housing providers might actually choose to defer necessary capital repairs, increasing both short-run operating costs, as well as putting the properties at longer-term risk of needing to be torn down. So in order to respond to the harms of these historical legacies, as well as the current challenges, we at ChangeLab like to think about this in a very similar way to the domains that were discussed earlier. And we believe that we need policies that get people into shelter that need it, that keep people in their homes, that improve housing quality, that help people access housing more freely, and that expand housing supply. And so since I'm here to talk about the role of code enforcement, I think we should go about and do that. First, let's define it. Local housing and building code enforcement is a system of law and policy that serves as the first line of defense to improve substandard housing conditions and protect residents' health. So code enforcement clearly plays a role in maintaining safe and affordable housing, as well as playing a critical role in keeping people in their homes. Code enforcement is also part of a comprehensive affordable housing solution, as it helps preserve a community's existing affordable housing stock by preventing affordable units from deteriorating to the point where they can no longer be inhabited, or where the economics of tear down and replacement make more sense. But to do this effectively, and promote health equity, code enforcement programs require strong housing codes, well-trained code enforcement officers, and cross-agency collaboration. They must partner with community groups, establish programs that assist residents and property owners, and then also collect and evaluate data from the field. But in doing so, by addressing housing issues comprehensively, code enforcement programs can help preserve housing and protect residents' health. And while most cities maintain code enforcement programs, traditional code enforcement programs have operated on a complaint basis. In this situation, city residents make complaints about code violation. City code enforcement officers then go out and investigate the complaints, and if substantiated, begin some form of enforcement proceedings, whether it be fines and fees or through legal measures against the landlords to remedy the violations found. But to really utilize code enforcement to promote health equity, one key strategy that was alluded to earlier is to flip the script on a complaint-based code enforcement system and instead create proactive rental inspection programs. And so proactive rental inspection programs, which are also sometimes known as systematic or periodic code enforcement programs, they don't prevent people from filing code-related complaints, but rather build on other aspects of a comprehensive code enforcement system to ensure that all covered rental housing is inspected on a periodic basis to ensure that the city housing stock is safe for tenants, well-maintained, and that property values are preserved. There's no uniform or standard PRI program, but they do typically share some basic structures, including registration of rental properties within the jurisdiction, periodic inspection of those properties, although the frequency of the inspections and the types of units that are inspected might vary, and then enforcement that's designed to incentivize compliance with the code enforcement regime rather than displacement of tenants or a crackdown against landlords. And so PRI programs offer a number of benefits to cities, tenants, and the public as a whole that complaint-based code enforcement programs can't. So to go over those benefits really quickly, PRI programs preserve safe and healthy rental housing and keep people healthy. They do this by bringing a prevention approach to code enforcement, helping keep residents from being exposed to substandard housing risks, such as lead poisoning, asthma, injuries, or other health problems in the first place. They also allow for regular ongoing dialogue between city officials, code enforcement officers, and landlords, helping shift the landlord-city dynamic from ignoring code enforcement to cooperation and compliance. And while PRI programs certainly help individual tenants, they can also help the larger community as well. First, they can help preserve safe and healthy rental housing. They can preserve neighborhood stability, property values, and the property tax base. And they can help localities understand and know what rental properties exist, who owns them, what the types of problems they have are, and how best to help landlords remedy any of the violations that might exist. PRI is also a valuable tool for protecting vulnerable tenants, preventing substandard housing that can fall through the cracks. And this could happen in a complaint-based system because, generally speaking, tenants, especially the most vulnerable tenants, don't file complaints. And there's lots of explanations for that, including language barriers, lack of familiarity with the code system, and fear of retribution by landlords. For example, experts have noted that many landlords that have been subject to the most slumlord litigation have never actually received complaints about the housing that they maintain. And so finally, just to say, when wielded properly, proactive rental inspection programs can be utilized as a social justice tool to ensure that all rental housing is, and that all people are benefiting from quality, safe rental housing. I know that we're running out of time, so I will just identify that there are PRI programs across the country in cities as small as Toppenosh, Washington, all the way up to the large metros and large cities in the US, such as LA, Boston, and in mid-sized cities like Rochester, New York as well. And so finally, just to hit on a point that was made earlier, while we're huge proponents of proactive code enforcement, I want to acknowledge that, as with many legal levers intended to promote health equity, there's always a chance that the levers we choose have unintended consequences. For example, while there's not much evidence surrounding it, people have expressed concerns that proactive code enforcement could contribute to housing affordability and instability challenges, landlords increasing rents to cover necessary housing remediation, or that there may be unintended tenant displacement resulting from inspectors finding tenant violations such as hoarding or condemning unsafe or illegal units. And then there's always the challenge of where we're directing our resources. And so these challenges are real, but so is the challenge of substandard housing. And so that's why I just want to conclude by saying it's important to think of these levers not as complete fixes to all of the challenges that I identified, but rather as part of a suite of tools we need to utilize to improve our health and housing in a more comprehensive and holistic manner. Thank you.
Great, thank you so much, Greg. And I can see by the questions coming in that those of you who are listening are feeling inspired and ready to take action, but also you're thinking a lot about how to overcome some of these barriers. You think about how do we sort of anticipate and overcome some of these unintended consequences, dealing with workforce shortages, the need to work with both landlords and residents and to make sure that everybody's aware of their rights and responsibilities. Also some questions about what the best options are, the federal and local levers. Unfortunately, we are at our time, so we had planned some discussion time for today that we won't be able to get to. If you've entered a question in the chat box or you want to go ahead and enter that in right now, we will make sure that we have the presenters follow up. We'll give them your questions so that you can get those answered. But with the last minute or two here, I want to make sure that we take a few moments to encourage all of you to attend or view the other webinars in these series and also to stay engaged in the conversation around housing. And so for just the last minute, I'd like to turn it over to my colleagues at the National Low Income Housing Coalition and Sarah Goodwin from NCHH to tell you about how you can get connected and stay engaged. Mike?
Yeah, thanks. Hey, everybody. This is Mike Kaprowski. I work at the National Low Income Housing Coalition. We're obviously very glad to be co-sponsoring this really excellent webinar series. And it's so important to raise awareness of how foundational housing is to health. So what I do at the coalition is I lead the Opportunity Starts at Home campaign, which is really the centerpiece of our cross-sector work. We focus on federal housing policy and really, engaging Congress to act more strongly on the housing crisis. But we can't just do it with housing folks alone. We need advocates from education and healthcare and civil rights and criminal justice, you name it. They need to be explaining to Congress why housing matters to them, because you can draw a straight line between housing and any of these other sectors that I mentioned. So we're bringing together lots of groups where, their bread and butter issue isn't necessarily housing, but they understand how housing shapes their respective fields. So we've brought in groups like the National Education Association, the biggest teachers union, Food Research and Action Center, Natural Resources Defense Council, Catholic Charities, NAACP. And we have about 100 national organizations from a lot of different sectors pushing on Congress. We also have 11 state-based campaigns. So The point here is that there are a lot of different ways that you can get involved with the campaign. So I'd encourage you to check out our website, which is in the top right of your screen. It's opportunityhome.org. You'll see all sorts of stuff on the website, letters you can send to Congress and fact sheets about how housing impacts other sectors and podcasts and videos. So if you're interested in the intersectionality of housing and health, there's a place for you to engage with the Opportunity Starts at Home campaign. So please check it out. Thanks.
Thanks, Mike. And my name is Sarah Goodwin, and I coordinate the National Safe and Healthy Housing Coalition. And the coalition is a broad and voluntary coalition of over 600 members from over 400 organizations, and it's run by a 15-member steering committee. Coalition activities include monthly action alerts, webinars on healthy housing topics, and opportunities for advocacy, including citing letters for federal appropriation asks every year and meeting with members of Congress both in district and in DC. So if you're interested in any of that, the sign-in link is on the screen, as is my email. So thanks.
Thank you, Sarah and Mike. And thank you again to our panelists, to my co-hosts at Temple University and the National Low-Income Housing Coalition, and to all of you for taking the time to listen today. And apologies that we didn't have more time for robust conversation. Again, we will get to your questions and get those individually answered. We also look forward to staying connected with all of you as you work to improve health equity and housing in your own communities. Thank you so much.